Hi, my name is Reena. I'm Dr. Smith's nurse. How are you today?
I'm good.
Okay, the doctor did tell me that you have some ear infection. I'm pretty sure he told you that. And I see that you came with pain to your right ear, which gets bad when you touch, and at the night time, and also some fullness in your ear. Okay. The doctor has already told you what's going on, that you have an ear infection. I'm just going to go over why this might have happened to you and what drugs he has prescribed, what their side effects are, how to take them, and what can be done to prevent this from happening again. Okay? Now, basically this condition, what the doctor has told you, the ear infection, the fancy medical term is otitis externa. And it's also commonly known as a swimmer's ear, because this kind of infection is basically seen when people are exposed to a lot of water. They basically swimmers, like the name says. Now in your case, you're on the swim team, so I bet your practice is long hours and you stay in water for a long time. So when you stay in water for a long time, and if your ears are exposed at that level of water, then there's always some moisture in your ear, and there's heat and humidity, because it's kind of dark in there, and that's a good environment for any kind of bacteria to grow. And generally this ear infection is caused by a bacteria. Of course, there are various other reasons why this can happen, but in your case, is you're swimming and you being in water for a long period of time is the causes that we think might have triggered that. Now, to treat this, our doctor has recommended some antibiotic ear drops, as well as for your pain, you can take some over-the-counter Tylenol or Motrin, whichever you prefer. Okay. Now I'm going to go over the side effects for the pain medication and the ear drops as well. Okay. Now, when you put the ear drops, the most common patients generally feel are the discomfort. The other side effects will include sometimes itching of the ear. Sometimes you may get the taste of the medication or the unusual taste in your mouth. Now, when you start the ear drops, and if your pain worsens, things don't seem to improve, generally in about 2 days you should start seeing improvement. But if the pain, you don't have to wait till then, but say you start the medication and your pain gets worse, your irritation gets worse, anything which should be improving doesn't improve, you can call us right away if our office is open, or you can go to the nearest urgent care or ER so they can look into the matter again to see what's actually going on. Okay. Now, apart from common reactions like skin rash, pain, irritation, itching, sometimes, it's not very common, but sometimes there are severe allergic reactions where you feel short of breath, you feel your tongue and lips are swelling, you feel your throat is closing, your chest is tightening, you can't get a good breath. Those are severe reactions, and if you develop anything of that, you feel that's happening, you need to stop the ear drops, go to the nearest ER or call 911, because that has to be addressed right away. Okay, because you need to breathe comfortably. Now, on the pain medication, the doctor said you can take Tylenol or Motrin, whichever you prefer. Now, both these medications have pretty much common side effects. With Motrin, you have to make sure that you don't take it on an empty stomach, because that can upset your stomach really bad. It can cause some real bad heartburn too. Okay. Now, some of the other complications which are seen in both these medications are nausea, vomiting, dizziness, headache, itching, ringing in your ears, sometimes even skin rash. If you develop a severe allergic reaction like the same type with the antibiotic, like you can't breathe, you feel short of breath, your lips and tongue is swelling up, you feel your chest is tight, your throat is closing, stop the medication, call the nearest ER, go to the urgent care, so that can be addressed right away. Okay. Once you start your treatment, if everything is going in the right track, you should see some response within 2 to 3 days, 48 to 72 hours, basically. Okay. Now, treatment is very important, and that is why we started this ear drop and the pain medication. Now, if you do not get if you feel like 42 days, you put the treatment, but nothing is happening, you don't develop any allergic reaction, but nothing is happening, you don't think it's improving, call us back, because we want to evaluate you to see if there is any obstruction, if there is any debris which which the doctor did not see today, if they believe that this is a therapy not working for you, they need to change your medication, switch it out to something better, or change it, we can do that. So don't keep waiting for more. You think this is not helping, call us back. We are more than happy to see you again. Okay? Now, if you leave this untreated, or you decide, hey, I put the drops today, I don't want to take it the next dose, well, that's not good. You have to stick to your treatment of the ear drop so you get this taken care of. Because if you don't get it treated, or you decide after halfway just to stop it because you felt better in one day, what's going to happen is you may develop hearing loss. These infections may come back because you need the whole dose of the antibiotic to clear it. Okay, so if you stop in between, they can come back, and they can come back very frequently, and that's what we call as recurrence or chronic. Okay, now if it continues getting worse, if it starts coming back over a prolonged period of time, which I believe you won't let it happen. I'm pretty sure you want to get back on the swim team and have a good time with water, so I'm pretty sure you're going to stick to what we tell you. But if you don't, then in severe cases you can develop like bone or cartilage damage, which is basically like a malignant or a cancerous type of condition, which I bet you don't want to go there. And in some rare conditions, it can also cause facial nerve paralysis or paralysis of the nerves on your face. Okay, so I'm pretty sure you don't want to reach there either. So follow the instructions that we give you, follow what the pharmacists tell you about how many drops and so forth. Okay, and once your infection is taken care, now I bet you do not want the infection to come back, right? So you can do some preventive methods to help it. Okay, now to begin with, in your case, it's the wetness or the moisture that we say is causing this, right? So till your ear infection is resolved, stay away from the water till it's taken care of. Once you get back to your team, make sure the ear plugs that you wear to prevent any water are well-fitting ones so that there's no leakage from there getting in and causing all your problems again. Okay, now after you swim, you think there is some water, you can always, whichever ear you feel you have it, you can tilt that portion, shake your ears a little bit so that will drain off. Okay, if you want to do something more, you can use a hair dryer or a blow dryer and put on a very low setting and gently dry the ear out. That will also help. Now, if you feel all these things are not helping dry your ears, you can talk to the doctor and see if he would recommend some kind of mild acidic ear drops that can help with drying your ears faster. Okay, now most commonly that we see is when you have any irritation in your ear, it feels nice to use an earbud and keep rolling, but it's okay to do that, but do not overdo it. The reason is your ear have earwax. That's something your body just generates automatically, and that helps and makes a barrier. That's your natural protective mechanism. You don't want to erode that or take that away, because then you're exposing yourself back to this bacteria and this infection. So do not overdo it. Do not frequently clean it. You don't need to clean it. Try the other methods. Try not to use this earbuds or the Q-tips. They are not highly recommended. So stay away from that because you do not want to clean your ears too much and dry out the wax. Okay, now let's go over how to use your eardrops. Now I know I talked a lot. I gave you a lot of information. It is too much to understand. Do you have any questions now? No. I'm going to give you this paperwork as well, so that way you have something to go over. It has all the information that I just spoke, as well as how to use the eardrops. Generally, it's the best practice is to have somebody, an adult with you, like your parent or your older brothers or sisters or somebody who can install the drops. Okay, so I'm just going to demonstrate and kind of show you. I'm not going to actually put any eardrops, because you'll have to go to the pharmacy to get it. I'm just demonstrating how with a mock eardrop, how you can use it. Okay, so I won't be putting any eardrops now, just showing how to do it. Now to put the eardrops, Few things, make sure your drops is close to you. Make sure you can position yourself in a comfortable way, either on a bed, lying down on the bed with the infected ear up, or on a table and just lay your head down. Whichever way is comfortable. Make sure after you keep everything ready, make sure the person, whoever is putting the ear drops, if it's you or if it's your mom, your dad, your brother, your friend, make sure they wash their hands well. Okay? The best way to wash is use soap and water. Just whatever you use at home. You don't have to buy anything special. And scrub or friction, because that helps to clean your hands well and take out any bacteria, whatever can come out. Okay? And you need to clean your hands using all these friction movements for at least 20 seconds. Okay? So you need to sing, the best way is sing 2 happy birthday songs. That pretty much covers 20 seconds. Okay? Don't do it in a wrap, it may be less than that. So just use your normal and clean it. Just for demonstration purpose, I'm just going to use some alcohol-based hand sanitizer. Okay, and what I'm doing is friction movements, waiting till it dries out, because that's the drying that helps to kill all the germs that are there. Now, after that's done, take your eardrops in your hand and gently roll them back and forth. The reason we do it, to make it a little warm, so it is comfortable. I bet using a cold eardrop is not something that will be a very comfort to you, or you may like it. Okay, so just warm it. Now the pharmacist will give you instructions whether the specific eardrops requires to be shaken. If so, gently shake it, no problem. Then remove the tip. When you remove the tip, make sure you do not touch the tip or anything else touches the tip. Okay, and once your drops is ready, you need to lay down with the infected ear up. So go ahead and lay down with your right ear up so I can show you how to do it. Yeah, the pillow is a good idea. Go ahead, lay down on this. Now, the best way to make sure you're putting it in the right, I'm just going to move your hair, but when you lay down, make sure everything is moved away, would be to tilt your ear upwards and then outwards. Get it? Pull it up and then out. Okay, what this does is this straightens your ear canal. That way when you put the drops, it travels right through. Okay, and then let me switch my hand. I'm sorry, I should have done it earlier. So once you lift it up and then you instill your eardrops. Okay, I'm not putting anything, I'm just holding it there. And when you're instilling, or whoever is instilling, make sure that the tip of the eardrop does not touch any portion of your ear, your hand, or anything else. It has to stay untouched by anything. Okay, once you put your eardrops, stay in the same position for about 3 to 5 minutes. That gives us enough time for the med to travel and reach wherever it needs to go to get a better effect. As soon as you're done putting the stop, you don't want to leave the tip exposed for a long period of time. Cover it very carefully so that you don't touch it or nothing else touches it. And then keep it away in a nice place, because you have to reuse it again. Okay? Now after all that has been done, so whoever put the eye drops have to go and wash their hands again to take out any medication that may be on their hand, or even when you try to position the ear, they might have touched. We don't know if just to prevent any kind of infection as well. The same method, wash it 20 seconds and you're ready to go. Okay? Do you have any questions?
Yes.
Okay, and this is your paperwork. It has all the information that I just went through, so you can use that. Okay?
Thank you.
All right. Well, have a nice day and hope you don't come back with your infection again.